Hi, I'm Dr. Ramiro Cabrera. I'm a pelvic surgeon here in the Global Endogen Institute. Today we're going to talk about, because the SRC asked us about deep endometriosis in this month of March, and remember, it's the worldwide month of deep endometriosis awareness, about what's the most important thing that people should know about deep endometriosis. And the most important thing is just the definition. The definition of deep endometriosis now have been changing around the years, and now we know that it's a chronic inflammatory disease in which endometrial-like cells are born and grow outside the human uterus. What it causes is chronic inflammation and also multi-organic dysfunction. So depending on the organ involved, you can be with some dysfunction in the bowel, the bladder, the pelvic nerve, and the diaphragm. Depending if you have endometriosis in the bowel, you will have inflammatory symptoms in the bowel, in the bladder, or other organs. So for us, it's really important that you, as a patient, should know the correct definition, because many surgeons doesn't still know what's endometriosis and what's the correct definition of it. The myths about deep endometriosis. One of the most common myths is that endometriosis gets cured after hysterectomy. Just by definition, endometriosis occurs outside the human uterus. So if you have endometriosis in the bowel or in the diaphragm, normal hysterectomy cannot cure you. The only thing that cures an hysterectomy is uterine problems like fibroids or adenomyosis. But remember, both diseases coexist with endometriosis, so it's mandatory for us during the same procedure to excise endometriosis at the same time. The second myth is that endometriosis gets cured when you get pregnant. This is a total myth. Let us remind that during pregnancy, many women, by obvious reasons, stop drinking alcohol and get tobacco consumption. As well, the placenta tends to grow a little bit the progesterone. That's the normal medication that we use for some endometriosis patients. So during pregnancy, the lesions tend to stop growing and also get inflamed, just because there's no more inflammation coming from the diet or the ambient. So with this, many patients tend to get less symptomatology. But at the end of pregnancy, if the patient continues to get inflammatory diet and everything else, then the lesions, because they are not gone, you will get again the symptomatology back. The third myth is that menopause cures the disease, even chemical menopause or induced menopause. We know now that endometriosis lesions produce its own aromatase. The aromatase is this enzyme that produces estrogen. So even if you induce menopause, take away the ovaries during surgery, or you get into your normal menopause, the lesions tend to grow little by little because its own hormones are produced inside the lesion, and that's why menopause cannot cure the disease.